Social value is a way of increasing the outcomes from public sector spend in a way that leverages greater benefits for the population than we might have otherwise got.
For NHS North West, social value operates at two levels, both in terms of the way we work with partners, create value in the way we use our own resources, but also in the way we influence the wider system. It really supports collaboration with local governments, collaboration with the third sector and a range of other partners to look at how we collectively use resources and again create that maximum benefit in local communities.
The Refresh programme has been a fantastic opportunity for the Borough Council and NHS to be working together. Figures came out that Blackburn with Darwen had the lowest rate of physical activity in England. So there was a partnership agreement that the funding would be for free leisure for people within Blackburn with Darwen. The Dragon's Den was actually based on the television programme. Community groups were invited to put in different bids for different community projects to promote self-care. Well, the funding was actually open not only to the smaller community groups but to the larger organisations. Blackburn Rovers work a lot with the community about promoting health and well-being, and the funding went together for promoting tea dances. The people who attend have a fantastic time and great exercise too.
I think in order to make social value the norm, we're going to need a lot of leadership really from government and from other leaders within the health sector. We need to give commissioners the permission to really build and embed social value in the procurement process and to ensure that really people can go out and use it as a tool to procure services.
One of the things we've done is work with our commissioning team and with other senior managers to ensure that they understood what the objectives were. I think now that we have the Marmot report on the social determinants of health, people understand this issue much more than they did.
Over the last year we've had some really good conversations with some key people within the NHS and within the Department of Health around how social value becomes really embedded in the health system. You know, if we can turn those conversations into practical examples, it's going to be fantastic.
I had to have major operations on my eyes, corneal grafts and stuff like that. So I've been out of work for ages, so I come here and found a job here.
We set up the Volunteer Learning Scheme because we wanted to give people in our local community an opportunity of gaining employment where perhaps they'd got backgrounds which prevented them from accessing employment in the past.
In my previous job, when I only worked the day for 2.5 days, I had a bad experience through my disability, for my hearing problem, telephone, and that's when I lost my confidence. And that's when I went through the job centre, and they advised me to go to work experience with NHS.
The future for these schemes looks very strong. We have been able to put this on a wider footing now, so that we've got partnerships both with local job centres but also with the Greater Manchester Coalition, and so we've been able to bring more people into employment from disadvantaged backgrounds, people with disabilities, and I think we'll go from strength to strength.
Oh, it is a tremendous effect. I just feel happy all the time because obviously I've been out of work for nearly 3 years and I've been trying to get into the care sector, and it's just tremendous. I just love it.
Benefits accrue to all citizens in the community, from the disadvantaged to the disabled to the wider public. It's about how we can work together as organisations, as institutions, for furthering development in the community.
There are barriers. I think it's really difficult, in particular when you're thinking about the challenges that people working in procurement and commissioning at the moment face. You know, they're meant to provide the answers to everything, so to try and get new things on their agenda, to try and change some of the knowledge and skills that are required to bring in social value is going to be a great challenge for all of us.
There are a couple of ways I think that the NHS can support the development of social value. One, like in the North West, is to create a social value foundation, and the aim of that will be to be an advocate to promote social value and potentially to grant aid real local developments that could help stimulate new thinking. The other is the work that we're doing with 10 SHAs across the country to look at how you can commission for social value. We've just produced a report on best practice in that respect.
there is good practice to be taken from right across the world, and if we can bring in as much information and knowledge as possible into our systems to really make sure we make the most of the opportunity, I think that would be great. And I think we've seen some great examples, particularly from some areas of the States, I think, where we can really learn and take that practice and bring it and put a northwest slant on it and really make a difference for our communities.
Personally, I benefited greatly from going to Missouri and looking at the Heartlands project that is over there, whereby agencies are working together to develop a sense of pride and well-being in a community that was on its uppers, that had a projection of, let's say, less than good growth, less than sustainability, and by pooling their efforts, by working together, they are turning round that sense and that investment in the local community for better outcomes.
I think if you take a health impact assessment approach, what that does is help you to pull out all the different types of benefits, whether they be local facilities, whether it be social networks, a whole range of different things, the different schemes.
Well, there are many ways that social value can manifest itself. From the obvious, like employment, which brings wealth to communities, from working with partners around some of the opportunities the health service brings to train people so they can get back into employment, by just being really good leaders in our communities, so you get great civic leadership in the old tradition where we try and create community cohesion. All of those things are manifestations of good social value. I think it's all about connecting with our populations, and it couldn't connect better into the new government's hopes around big society. Seems to me that the health service, like all public services, has really got to engage with its population. So is social value part of the future? I think it probably is the future.